Good afternoon, I'm Susan Knotts. I'm the nurse manager of OB at Marietta Memorial Hospital, which is also known as 3 West, or the Women and Newborn Unit. And I've had the privilege of being here in this organization for 21 years as a nurse manager. I was very excited when the Memorial Health System joined the Mayo Clinic Care Network. I immediately thought it gave us opportunities to have expertise that we'd never had before. I did wonder how it would work and what it would involve. As a nurse manager, there's many times I spend a lot of time looking for the newest evidence, looking for policy updates or new practices, things we want to implement, and to have world-renowned experts at my fingertips and to save myself time to just ask for the resource and then get it back. I can then spend time doing what I love about my job, which is spending time with patients and families and making sure we have great care here. We have a Nitronox, which is nitrous 50/50 for support and comfort in labor for patients. This is something we never had in the area or the department before, so I appreciated that expertise and receiving the policy and the protocol to help us implement quicker for our patients. It saved me 8 to 12 hours of work, which would have been looking for evidence, searching out research articles, looking at other places for evidence, and developing the policy. I was actually able to take their policy and just rework it a little bit to make it our own and go on to actually working on getting the equipment here for our staff and our patients. The process was very, very easy. I went onto the website. There's a very short form I filled out, asked me what I needed, why, what quality or safety, how I would determine what I was looking for, filled out that form, and clicked a button to send it. And then within 1 to 2 days, I got a response back internally that the project had been accepted. And then within a week or less, I had policies in my hand to work with. We've already began using the tools in my department based on my easy and kind of seamless experience the first time and the results. So just recently, I submitted another request. We're in the middle of doing annual policy update. So I had a whole list of policies that we needed to update, and my first thought was, again, not spend all that time looking for the research when it's already there. We've got an expert at our disposal. And then there were some specific policies that through our OB steering group, the whole group wanted to look at some up-to-date practices that we knew we needed to review and decide how to make changes. So I did a separate request for those specific things, which is some management of labor items, our fetal monitoring policy. I was specifically looking at high risk, low volume, or high risk policies. I wanted to make sure we always look at the newest evidence, our national organizations, A1, ACOG, and I knew from my previous experience that if I got Mayo resources, they would have all of that there for me and have the most up-to-date information. And again, when we work as an organization, our whole drive is to provide families care right here at home. And I'm excited that we use all the resources we have, like the Mayo Clinic Care Network. And it is my drive to do what I do and to continue to work with this organization and look forward to the future as we grow in our relationships with other facilities to provide more care in this valley.